Hey guys, this is Dr. G, your arthro guy. I'm in front of a physical therapy building right now. Just to give you an update, a few weeks ago, I tried to go up the steps and had a little buckling episode in my knee. And ever since then, the knee has been bothering me a little bit. And I figured that it's time to get started with conservative management. At this, up to this point, I was able to avoid any treatment because it wasn't really giving me a pain, but now it does, unfortunately. So I'm going to start physical therapy and get my legs stronger and hopefully avoid any aggressive treatment for a while. So, keep following my journey and we'll see what it entails. I decided to pick Legacy PT because Greg Turner, who is an excellent physical therapist, had a great reputation. I've been talking to him a lot. I do like his philosophy, how to he tailors his therapy to each individual's needs. So I just wanted to see how he does it. Hopefully I can get some good benefit from it. So follow along. So here I am. I parked my car in front of a Legacy PT, walking around, feeling quite nervous that, yeah, it's my first time doing actual PT. I've been doing a lot of my own workout, but this is really my first time seeing a certified physical therapist to work on my leg. So here we are entering. You can see that there are some people working around. They don't know whether I'm taping or not. All right, here I am with Greg Turner, who's the physical therapist I've been talking about. So it's our first initial visit. So
yeah, well, welcome.
Yeah.
All right. Well, Young, with everyone that I see, I always like to just ask,
sure,
what brings you here to therapy? And I know a little bit of the background, obviously, already, but
yeah,
want to hear about what's going on, and then also start to refine and what your goals would be here for physical therapy.
I had my ACL reconstruction about 12, 13 years ago. That was sort of a delayed surgery. I tore it probably a year before that, and nobody was willing to get MRI, and so there was a delayed diagnosis. And by the time my medial meniscus was quite shredded, so by the time that I was getting ACL reconstruction, there's a fair amount of the meniscus that was removed and debrided. So I knew that there was going to be a problem down the road. I stopped running. Knee was giving me some issue even after recovery from ACL reconstruction, but I just didn't have a pain for a while. Until a few weeks ago, I was going up the steps, like this 2 steps at a time, just in a hurry, and it felt popping, felt a sharp pain, and ever since then, just been having a lot more stiffness, discomfort. I would say maybe 1 out of 10 or 2 out of 10 pain with long walking, long standing, sort of a medial side. Once in a while, I get that little clicking and popping.
Is the click and pop itself painful, or is it more of just a
discomfort?
Noise?
Yeah, discomfort. Yeah, it's more actually in a kneecap area. Sometimes I can reintroduce it. I think it happens more when I'm standing for a long time and I'm just trying to do this and pop sort of along that little patella or the kneecap area. Can be very loud for sure.
All right.
Yeah.
Do you have any other symptoms elsewhere in kind of your leg, whether it be foot and ankle, up by your hip, pelvis, spine?
I mean, from everyday stuff. I mean, I'm seeing Jerry for some time, for 2 years, and
he's hurting you. No.
Yeah, he's hurting. Yeah, he's a big guy. Anyway, he's a performance coach that he's been working a lot. My shoulder, I got some rotator cuff issue, some lower back issue, hip issue. Tight calf and all that, not really helping, to this cause for sure.
Okay, yeah. And so then, I guess, what would you say your goals are for PT at this point?
Oh yeah, good question. I mean, I try to get better. Try to be more mobile. Less of episodes of a knee popping, clicking, and having a pain. Hopefully, I guess with anyone with any pain, the goal is to not to have pain and preserve your knee joint as much as possible.
Right.
And hopefully avoid a surgery until I'm 50 or older, or maybe
well,
forever.
that's
I don't know.
You're
Maybe,
not an
I
old
don't know
guy,
whether
but
it's
so if
possible.
we can
Yeah.
avoid that, that would be ideal.
Yeah.
Yeah. What I like to do then is take you through a whole kind of exam.
Sure.
Right? I can't treat what I don't understand. Well, certainly enough of the history, kind of, even just looking at imaging and whatnot, certainly sounds like some early OA in that knee joint from the medial aspect and whatnot.
Yeah.
I always like to look and see how does it
Sure.
behave, right?
Yeah. Sure.
And move you as a whole person. So we're gonna honestly start at your spine, work our way down,
Okay.
look at range of motion, strength, flexibility, balance, all that good stuff, and just see, does any of the stuff that we do influence what you feel at your knee?
Yeah.
Good or bad,
Yeah.
right? And from there, that helps to refine kind of my hypothesis of what's going on and start to be able to craft a program
Sounds
tailored
like a
to
good
you as
idea.
a person. All right?
A good idea.
Do you have any questions for me before we look?
No, let's get on.
All righty, my friend. Let's do this. I'm gonna have you stand up if you don't mind. And
I need to get this
yeah, you're all good. All right. In standing. Let me ask you this, to refine some of my thoughts, even with what you're doing with Jerry and kind of your own training and whatnot. How often a week are you going to the gym versus doing things independently on your own, perhaps at
So I go
home or-
once a week
Okay.
to see Jerry on Wednesday.
Okay.
Actually, I saw him today.
Okay.
And then I do my own thing like 4 or 5 times a week, or try to as
Yep.
much as I can.
Sure.
Try to
Okay.
make some cardio workout and stretching as well too. And as you know, I don't have a whole lot of time, so I try to squeeze in like 30 minutes of a workout that he assigns it to me.
Okay.
So usually half of what he usually gives me.
Yeah. Right. It's just
Yeah.
function of time.
Yeah.
Do you notice any of the movements that you're doing being provocative to the knee of hey, every time I'm doing something more laterally based or
No, I haven't really noticed it
rotational?
actually. Yeah, if anything, that all those exercises, I feel like I feel better afterward.
Okay,
Yeah.
great. So here's what I'll say. The good thing right now is one of the things that we did was like, oh wow, that really grabs my knee or really provokes it, right? And
Yeah.
you've got pretty darn good motion. You're missing 4 degrees of flexion compared to the left,
Okay.
right? Which there's an element that can be within the standard error measure for me,
Yeah.
using the goniometer to measure, but I can feel it's a little stiffer going into flexion.
No, definitely.
Just,
Yeah.
But it's a small amount
Right.
of
I definitely
loss.
feel that stiffness too,
Right.
in my right knee.
And we can even see it prone when I can bring left heel right to the buttock, no quad restriction whatsoever, anything like that.
Yeah.
The right, it's a little tougher to get there.
Sure.
Obviously, isometric strength. You felt good, right?
Mhm.
The quads, the hamstrings, none of that provoked pain, so that's a good thing.
Yep.
Look up at your hip and pelvis. Glutes have some weakness, nothing like, oh my gosh, that's egregious, but you could even feel a little bit tougher on the right than the left. And the reason I bring that up is whether it be stair climbing, whether it be squatting, right? Or so many functional tasks that we do, it's a 50-50 share between knee and hip, right? The glutes and the quads are both those extensor muscles that are going to push us up, and if the glutes are not doing all their fair share, we can become a little more knee and quad dominant, which can then exacerbate some underlying OA or other conditions obviously at that knee. So I think continuing to refine some glute work is going to be really beneficial to you.
Yeah.
And that also parlays into obviously protecting your back, right, and your spine long term. So I kind of want to unpack with Jerry and you a little bit more of kind of what all he's having you do. Again, he's fantastic at what he does and obviously programs extremely well. And that's where I just want to make sure anything I give you as well is not kind of double dipping or overworking or that kind of thing. I want to complement and make sure we're working together on that. So I definitely think though there's some upside on the glute piece and getting those hips to do more of their fair share to protect the knee.
Yeah.
I want to try to see, can we get that little restriction out of the knee? Okay. And again, I didn't have the privilege of assessing this prior to, the knee. So maybe it's been lingering there ever since your ACL, right? It's possible. I don't know. But you also have that little bit added calf restriction on the left, which can influence then the squat mechanics if you're then diving a little bit deeper to the right.
Yeah.
Have you done any of the force plates and stuff at Jerry's by any chance? I think he was getting them in. Maybe they're not in yet. He was going to get some force plates that look at loading and whatnot.
Oh, okay.
I think they were coming in.
Okay.
Maybe they haven't arrived yet.
I haven't done that.
Yeah. Okay. With that said, I want to try to free up that last little bit of motion, work on the glute strength, and then guide you through a couple of the flexibility things as well. And again, that little bit of adverse neural tension that I think you get there, which I would propose is coming from the back. How does that parlay into then how you move and influence that? So I want to see if we can reduce that a little bit too with some specific measures.
That's good.
So if you want, are you up to doing a little bit here today, time-wise?
No, it's good.
See if we
I start my clinic at 9:30, so we got plenty of time.
We got time. Okay.
Yeah.
So I'm inclined to have you. Let's lay prone.
Okay.
Okay. And we know kind of measurement-wise what we felt there. And in that position, are you feeling anything in the back at all? Anything?
Not really. No.
No. Okay. If I had you put your hands as though they're in a push-up position.
Like this.
Yep. And imagine your spine as a string of pearls. We're going to start with the first, bead and sequentially go down into extension. I'm just going to have you press up, try to get as nice big of a curve in your spine as you can, leaving your belly, your back, your butt all relaxed. Arms do all the work. Yep. And then back down and relax. What do you feel there? Anything in the spine or anything in the leg?
No, not bad.
Not bad?
As I'm coming down, actually, I feel a little strain on my right pair spines.
All through here?
A little bit there,
Okay.
yeah, but
Did it diminish then when you stopped?
Yeah, it was more of an eccentric kind of.
Okay. Let's try it again. I want to see if it changes with some subsequent repetitions, okay? So let's go pressure on, pressure off. Yep, arms do the work coming back down. You feel the same?
It wasn't too bad actually.
Well, a little bit better than the first time?
Yeah.
Okay. Let's do maybe 10 of them total if you don't mind. Same proximal hammy pull.
Yeah.
Does it feel like that's more intense than before, less intense?
It feels pretty good.
I was gonna say, that's higher. Can you tell
Yeah.
it's higher?
Yeah.
If I bring it to about that same angle we were at before, does that really ramp up in the calf like it did previously?
I mean, still stretches.
Okay.
Yeah.
Builds more? Or not so bad? Does it feel any different than the first time we did it? Or hard to say?
That was pretty similar.
Pretty similar?
Yeah.
Higher.
But definitely, yeah. I feel like I'm stretching better.
Yeah, a little more mobile there, but how about this side? Does that go to your low back?
Yeah.
Okay. How about here? Is that in the low back?
Not much.
Not much. Okay. What does that do?
Yeah, stretches the calf.
All right. I want to actually check something on your hip flexors too.
Yeah.
Stand on your back. Why? Can I have you slide to the left?
Yeah.
Good. I want to just check your mobility here. So I want to bring this leg up just to try to keep the back nice and flat. If we just let this angle down. What do you feel there? Little pull, little pain? Nothing at all?
Nope.
Little stretch?
A little bit. Not bad.
Just from the thigh? Or where do you feel it?
Yeah. I mean, it's not bad at all.
Yeah,
I don't really
pretty
feel
mild.
much.
Yeah. Okay. Pretty good motion there. How about with the right? How about that side?
A little bit more stretch there than the left side.
Okay. Just in the front of the thigh?
Yeah,
Or-
front of thigh.
Okay.
Yeah.
Great.
I always feel that too. That right side is always a little more
A little restricted
yeah,
there.
restrictive.
Okay.
With the hip flexor.
Got it. Okay.
Yeah.
I'm gonna just check something else at the knee too here, motion wise, as far
Okay.
as
Good. Kneecap.
patellar. Is that
No pain.
uncomfortable at all? No? Okay. Does that feel tight at all?
Not
Through
bad.
here?
Not bad, actually.
Yeah. Feels a little looser.
Hmm?
Felt a
Yeah,
little looser
yeah.
to me,
Yeah, you've done something.
which is interesting because we really didn't do much
Right.
to it.
Right.
So
Probably
there's
warming
also-
up.
Well, maybe, but there's also that aspect of, oh, sometimes the spine can be the master of disguise too,
Yeah.
which I don't know. We'll see. Is there anything you know you could do right now that would create the popping or the pain? If I took you down to the basement or the squat rack or like
Yeah.
doing steps down to the basement or something like that? Or
Sometimes, like, you know, it's after a day of standing for a long time, it gets
Mhm.
stiff, and then if I do that, it might pop. I
okay.
don't think I can reproduce now because it feels pretty fluid to me.
Yeah.
Usually it comes with, you know, knee being stiff and
Hmm.
having a pressure on it after we're walking for a while.
Yeah.
Not this one, it's a lot louder than this. This is just nothing.
Yeah.
And it just has a loud,
Just
it
goes.
did a little click on it. It was more of a kneecap, I thought.
Mm-hmm.
There you go. You heard that?
I do.
Yeah. So there you go.
Yeah. Got the noises.
Okay.
All right. Well, here's what I'm inclined to do. I want to build out a program for you of some things to start having you work on
Sure.
here. Good physical therapy looks like a combination of manual therapy coupled with corrective exercise.
Sure.
The interesting thing is, again, you don't have tons of restriction where I feel like, oh man, you need a ton of manual therapy. I think probably isolating out a little bit here, even at the low back, might be beneficial to you long term. A couple of, general stretches, but I think in large part we can build out a bunch of corrective exercises to complement what Jerry's doing with you and what you've been working on independently, and merge those together to see. I think we'll be able to buy some time on this. I really do.
Yeah, that'd be great.
With how much motion you have there, I think that's obviously a really good sign.
Yeah.
And the fact that it's not some big joint effusion
Yeah.
is also a good sign, of course. So